Good afternoon to everyone, or good morning to those on the Pacific Coast. We'd like to welcome you to today's webinar. Well, it's really not a webinar. It's going to be a conversation. And this is Darlene Jenkins from the National Healthcare for the Homeless Council, and I'm co-presenting with Ellen Lawton from the National Center of Medical Legal Partnerships. And we also have a special guest that you'll find out more about as we go on into the presentation. This should be approximately a 45-minute conversation, and I say conversation because we like to invite you to please put your questions in the chat box, and we will address them as we move along into the presentation. This webinar is being presented by, I need to acknowledge our funder with the Health Resources and Services Administration, and the contents of this webinar does not necessarily represent the official views nor an endorsement by HRSA, HHS, or the U.S. government. And if you have are looking for more information, please visit HRSA.gov. So now we're going to take time to introduce ourselves. Ellen, are you there?
I am. Thanks, Darlene. Hi, everybody. Thanks for joining us today. My name is Ellen Lawton, and I'm the co-director of the National Center for Medical Legal Partnership, which is at George Washington University in the School of Public Health. And I'm trained as an attorney, but have been working in medical legal partnership for some time, and really look forward to working with you today and presenting some of the great information that we've pulled together for you.
Great. Thank you, Ellen. Yes. And this is, as I said, Darlene Jenkins. I'm Senior Director of Programs at the National Healthcare for the Homeless Council. We are a national cooperative agreement with HRSA to provide training and technical assistance to health centers that serve individuals experiencing homelessness. And we have been working very closely with the, I think it's been the last 3 years, with Ellen and her group regarding how to really develop medical legal partnerships in healthcare for the homeless health centers because we know that there is a great need. And so we're going to go through this afternoon some of the work that we've done, as well as introducing to you a learning collaborative that we're going to be beginning. So those are some of the information we'll be sharing with you. Ellen, would you like to share this quote from our good friend Jack Tsai?
Yeah, so thank you, Darlene. You can see, and some of you may be on the phone and not in front of a computer, but this, I think, really encapsulates what we're trying to achieve, which is that it's a quote from Jack Tsai, who's done some of the best research on the link between homelessness and legal services and health. And he says, providing legal assistance where clients get their health care can improve their lives in both worlds. People don't think of legal and medical problems as related, but actually resolving one can help the other. And that's really why we're here. So look forward to that conversation and responding to questions that you have. Thanks.
Thank you. So as we look at, for this afternoon, our agenda and our learning objectives, we really want you to, once you've gone through this, hopefully you'll be able to describe the 3 common social and legal needs that affect health for people who are homeless, and also to give you a snapshot of some of our current work. And we have resources in the box. There are several different papers that we have co-authored with Ellen and her group, in addition to the special health affairs article that was written by Jack Tsai. And then we also would like to, at the end, identify the process for applying for our medical legal partnership learning collaborative. Excuse me, I'm sorry. So now, as we begin, I'd like to just remind everyone that, of course everyone knows this, that homelessness is a very complex circumstance in which people find themselves. When you see someone who is without stable housing, you really are just looking at the tip of the iceberg, but there's several different things that are going on underneath that has driven the circumstance of homelessness. I've added, in fact, one in particular that has happened recently, the natural disasters have driven the rates of homelessness. We have a lot of newly homeless as a result of the hurricanes and the floods and now the fires that are happening in California. And so there's various drivers to homelessness. So when you see a person who is experiencing homelessness, you're just seeing the tip of it. And so we have to really drill down to understand what's driving it and how we can find solutions to this particular situation. There's a complex legal system that also drives the social determinants of health, and as we talk about the social determinants of health, we know that these are the social and economical factors that actually lend itself to health. We know that having access to medical care is great and is needed, but then there are conditions that also cause individuals to be sick. And so unless we address the conditions that are driving illness, we can patch them up in the health center or the doctor's office, and then we send them back out into the conditions that are making them sick. And so it's very, very important that we address the social determinants or the social and economical factors that are driving health. And these are some of the things that are associated with the legal system that also affect a person's health and can have an effect on a person's health. So as we kind of backtrack, I want to set up a background for you today to kind of tell you, to kind of lead you to what led up to this point of where we are today. So about 3 years ago, we decided as the National Healthcare for the Homeless Council to find out more about the social, civil needs, the social and civil legal needs that are driving the health. As I said, looking at the social determinants, we have to also look at some of the legal needs. And so we decided to really find out what was going on because we had, at that time, had no idea. So we partnered with the National Center for MLPs to conduct a survey. And the survey was really to kind of find out what the highest priority of civil legal needs were that were impacting patients' health. We kind of did a mixed method type of approach to this survey. We did focus groups. We talked to individuals who are providing health at health centers, asking them what they felt the highest priority civil legal needs were. We had an advisory committee that helped develop our survey. And then we also had some consumers who received care at health centers to provide questions as well and to review them. And then we administered the survey to our 61 practice-based research network members, and this gave us a very good kind of information that we were seeking regarding the civil legal needs. The results from the survey is kind of shown here. I won't go over all of it, but as you can see, 42% of the respondents said they were currently screening for legal needs, but 92% said that they were not familiar, had very little knowledge or somewhat familiar with civil legal aid programs. And so we recognized just from the results of this that we needed to do something as far as being able to help connect the medical as well as the legal professions together in the form of healthcare for the homeless, health centers, as well as medical legal partnerships. As we talked about, as the providers gave us the feedback, you can see the highest need that they reported or priorities that were affecting their patients' health was housing, that's no surprising, their landlord, evictions, unsafe housing, and these are not mutually exclusive. They were able to select all that applied, and so you can see some of the other issues that were there, as well as identification issues, stolen identities, and then immigration and legal status. We also wanted to know on the other side of the coin, we wanted to hear from the consumers, and so we conducted a survey at our national conference with the consumers that were in attendance, as well as one of our National Consumer Advisory Board members, steering committee members, did some survey collection at her health center, and we analyzed this. And so we this is what the consumers told us. So the first slide, or the previous slide, was telling you what the priorities of the providers thought, the legal needs that they felt was impacting the health of their patients. And these are the consumers, what they were telling us, what was impacting their health while they were homeless. And so their number one issue was employment needs. They felt that they were unable to find employment, or there was a bias because of their housing status, as well as the inability to get unemployment benefits. And then again, housing and landlord issues was something that ranked high. And we did find that the majority of the consumers that participated in the survey had experienced at least 4 or more of the civil legal needs while they were experiencing homelessness. So we know that this was a big impact. So we identified the priorities, what the providers felt were the priorities, but then we also asked the consumers what they had experienced while they were homeless, and this was the list that was given to us. So I'm going to turn it over to Ellen now, and she's going to talk about how lawyers can solve some of the social determinants of health problems that this population is facing. Thank you, Ellen.
Great. Thanks, Darlene. Hi, everybody. And I'm not going to spend a ton of time here either, except to say that, some of the problems that Darlene has walked through really are, they're complex issues, right? And some of them can be easily resolved with the right information, and some of them require quite intense advocacy. And many of them really require a team approach. And so for those of you who are on the call that are coming out of healthcare organizations where you may have multiple team members that are trying to work together to resolve social determinants of health problems that are happening outside the 4 walls of the clinic, the part of the goal of medical legal partnership is to incorporate legal expertise as part of the team response to complex social determinants. And so it may be that having a lawyer advocate directly one-on-one with a patient is really an important facet of helping to address that social determinants issue. But it may be that providing better training and consultation for a healthcare team is going to help the healthcare team, for example, improve emergency access to insurance benefits. And so I encourage you to think broadly about this, but also very concretely about the role of lawyers alongside the other activities that you're pursuing within your healthcare organization to try to both screen for and then address social determinants. Next slide. Great. I want to pause for a moment, and you have this really excellent article, and it has Jack Tsai's name as a lead on it, but he is not the only author on this health affairs article that we're sharing with you, both in the resources, and that is, this is a little bit of an advertisement for this really excellent piece of research that was done between New York Legal Assistance Group, Legal Health, which is part of New York Legal Assistance Group, which was partnered with VA medical centers in New York, alongside Connecticut Veterans Legal Services, which is anchored in New Haven, Connecticut, and partners with New Haven Veteran Health Center called Aurora Center. And they conducted, funded by Bristol Myers Squibb Foundation, a really excellent study looking at who was getting legal representation in a cohort of veterans and what the impact of that legal representation was. And they had some fabulous findings that we think really signify the impact of integrating legal services as part of your team, especially for complex patients like homeless veterans. And so you can see some of these findings here on this slide, and we also reference the findings and call them out in the fact sheet that is included in the link to the resources. And so So what we're really here to say is to take a look at those resources, think about how they might apply to your particular settings. And I also want to just say on the right-hand side of this slide, a note on the cost of MLP services. They had some really, I think, helpful findings for the field in terms of the amount of legal services, the approximate cost, and then looking at legal issues addressed. Next slide. Great. And again, this is all going to look familiar to you now. These are the findings from the Bristol-Myers Squibb funded teams in Connecticut and New York who did this research and wrote about it in Health Affairs. And these were the findings in terms of the legal needs that consumers had. And you can see the overlap between the slides that Darlene shared, the one that I transitioned on, and now again reflecting here housing conditions, benefits appeals, challenges with family law issues, housing discrimination, etc. Next slide. Great. Now I have the opportunity to share with you a really marquee program that's doing terrific work in Silicon Valley. We're very fortunate to be joined today by Marlene Bennett, who is a supervising attorney at the Silicon Valley Medical Legal Partnership, and she's going to talk to you a little bit about their work and their struggle as well as their successes, and will be available to field questions as we move forward. So Marlene, take it away.
Thanks, Ellen. So my name is Marlene Bennett. I'm a supervising attorney at the Law Foundation of Silicon Valley, and we are the legal partner at the Silicon Valley Medical Legal Partnership at Santa Clara Valley Medical Center, which is a mouthful. So I'll tell you a little bit about our MLP. As Ellen said, it's been a long road. For us, we started planning for our MLP in 2007 with a couple of Equal Justice Works fellows, and got those approved, and then in 2009 our services began on site. Valley Medical Center is our county hospital system, so we are working very closely with their satellite clinics. So in 2009 our services started in pediatrics at 2 clinics in the county, and then our adult services started at 1 clinic, which is housed at the main hospital in San Jose in their specialty center, and we were focused specifically on people living with diabetes. So those projects took off and moved forward with our Equal Justice Works fellows. For those unfamiliar, the fellowships are 2 years. So at the end of the 2 years, we kept the services going. And then due to funding issues, in 2012, we actually had to stop going to the site at the Valley Specialty Center, but we were still taking referrals and trying to help those clients as best as we could, but we weren't actually on site at the medical center. And then in our county, there was a big bond measure passed to help with various types of services for people experiencing homelessness. And we were lucky enough to be chosen as one of the beneficiaries after the measure was approved. And so we were able to revamp our adult services and continue funding our pediatric services. So in 2014, the new iteration of our adult side of the MLP started at our Valley Homeless Healthcare Program. And we are on site at VHHP 2 half-days a week in 2 of their clinics. They have a main clinic on the east side of San Jose, and then they have another clinic out at a respite center at a homeless shelter. And so we spend a half a day at each of those sites every week since 2014. And throughout all of this time, the pediatrics continued. And then in 2016, we expanded our services, both adult and pediatric. A new health center opened in downtown San Jose, and the hospital came to us and said, we really want the MLP there to help the clients who are utilizing that clinic, and also to sort of garner attention to the clinic to encourage people to utilize that site. So we started there about 2 years ago. And the other thing that started going well for us was that the measure, Measure 8 was called, the funding from the bond measure ran out, and the hospital decided to fund us themselves. So now we are a full part of the hospital's budget for both our pediatric and our adult MLP, which has really been a game changer for us because we know that these services are secure and our clients aren't going to see any disruption in what they have come to rely on. And additionally, our staff, our attorney staff, have really become integral parts of the staff of these various clinics where we're on site and work in very deep partnership with the medical staff. So in 2016, our pediatric practice decided to expand age eligibility up to 21 years so we can capture those transition age youth, In 2017, we were very grateful and fortunate to be a winner of the National Outstanding MLP Award from the National Center for Medical Legal Partnership. And then in 2018, we did an additional expansion, and we're now doing name and gender changes for anyone of any age if they are eligible for the MLP services. And then just this year, we received a request from our medical partner, Valley Medical Center, to expand our adult services to additional departments, including oncology, palliative care, cardiology, and back at the specialty center where we started almost 10 years ago. So we're in negotiations around that now, but we're very excited to have more of a presence with more communities that utilize the county medical system. And we are also looking to include adults and pediatrics in these different departments, but still the ink's not wet. We're still working on it. So that's where we are today. It's been some very great progressions and then some minor setbacks, but where we are now as compared to 10 years ago is I don't think we ever thought we would be this sort of embedded in the hospital system and working as closely as we are with the medical staff.
Great, thanks Marlene, and I know that there are lots of questions out there in the field, and I just want to say that we're very fortunate that the team from Silicon Valley is going to be joining us as faculty for the Learning Collaborative, and so that's, I just think, important for you all to know that those learnings we're hoping can go peer-to-peer here through the Learning Collaborative. And I know you have one other slide there that just kind of depicts, if we could go to the next slide, there you go.
Yeah, this is just a quick snapshot from 2016. This is a breakdown of every legal issue that a client presented to a provider at one of our MLP sites. This includes adults and pediatrics. So just in comparison to those slides we were seeing earlier about what providers felt people might be encountering and what the consumers themselves say, this is what we see in our practice. And we don't practice in all of these areas, but we will at least give counsel and advice or someone a meaningful referral. But yeah, this is, like I said, this is what we thought in 2016.
Great, thanks Marlene. Let me just pick up a couple of questions, and then we're going to move to the next slide, which is kind of unpacking. Darlene's going to unpack the Learning Collaborative. We've got a question there about the difference between pediatric and adult legal services that are provided, and I mean, I think it's, I'll take a stab at it, and then Marlene, if you want to add some color commentary, but in general, you know, the example, I think, is that there are special services, for example, special education, that are unique to pediatrics, just like employment services are unique to adults. But there are also services and advocacy around housing that's ubiquitous no matter whether you're dealing with a child or an adult or a family. And so it really depends on the population you're taking care of and serving and how you want to build your services. But Marlene?
Yeah, that's spot on. So on the PEDS side, we have a pretty robust education practice. We also represent some unaccompanied minors, whereas our adult side doesn't do any immigration. And then on the adult side, the bulk of our work is public benefits appeals, but we see some of those on the pediatric side as well. And that housing is the major crossover. And then name and gender changes, we do those on both sides as well. We try to be just a holistic legal services provider at both at both pediatrics and adults. But there are those sort of specialty areas, like you were saying, Ellen, that only apply to kids or only apply to the adults.
Great. So I know we have one more in the queue, but Darlene, maybe we can move through the Learning Collaborative description and then move back to the questions. Does that make sense?
Sure. Yeah. Whatever. We can do that. I think our time is we're still looking pretty good. So let me go to describing our Learning Collaborative, and then we'll come back to Carrie's question that she asked about the data and outcomes. And if anyone else on the call would like to add questions, please do so, and we will answer them after we finish explaining the Learning Collaborative. So this is really the main focus of the presentation today. We are starting HCH Medical Legal Partnership Learning Collaborative, which is going to be a cohort of health centers or medical respite programs where we will actually try to help walk you through steps to get you to develop an MLP. So you can see the goals listed there. It will also give you an opportunity of peer learning, as Ellen shared, that we will have Marlene and her team with us. They will be able to give some insight of lessons learned and also opportunities. And then we'll be actually building a foundation of knowledge through, it will be a 2-year process. So the first year will go from December 2018 to May of 2019, and we'll be helping to develop plans and the next steps in year 1, and then next step is in year 2 to actually establish and implement an MLP. Now, this may be somewhat ambitious, but we do want to at least get people on a track to where we want you to go. So if indeed, and we'll be giving you an assessment, so if indeed you are just beginning the conversations, we will at least pick some type of benchmarks that we want you to accomplish along that path. If you're in the intermediate stage where you've started conversations, you kind of have identified your legal partner, well, we will also again help to get you to a benchmark or a place where we can at least say, okay, by you participating in this Learning Collaborative, you will have reached a certain point. And so depending on where you are, we will work to get you to hopefully a certain point within that year 1. And then if you're an expert, then of course, many times the main thing is sustainability. And so how do we help kind of look at that and to help take you to where you are perhaps in the advanced or expert stage 2 sustainability, if that's where you want to go or another place. So the Learning Collaborative is really trying to not only help with peer sharing, but also to help those who are involved to get to some type of outcome or point where we can point to saying, you participate in this Learning Collaborative and this is what you have achieved by participating in it. The eligibility criteria is just basically receiving 330 funding for special populations, or you can demonstrate that you provide services to homeless or at-risk populations. Also, to be able to commit to at least having one key staff member to participating on all the sessions of the Learning Collaborative and the face-to-face, and then the ability to commit to completing all homework assignments and self-assessments. And the homework is just basically, looking at, and it'll be articles and different things that we'll be asking you to complete, and you'll have plenty of time to do that. Let me share with you kind of the timeline of what we're doing. So we're actually kicking off the Learning Collaborative now, and we'll give you the link to sign up for the app, to fill out the application. And then we're going to have 3 90-minute interactive virtual trainings, and that's going to run from December to March. And then we'll do a face-to-face at the National Healthcare for the Homeless Conference and Policy Symposium that will be in May in Washington, D.C. in 2019. Also, as I mentioned, we'll be asking everyone that's participating to have an action plan so we can see, again, we want to move from point A to point B. and it's an individual action plan. Depending on what your organization would like to achieve, we will help you get to that point. You will share your action plan as well with participants during a virtual training in March, and then we will report on the action plan and next steps at the face-to-face meeting in May, and that will set us up to go into the learning collaborative of the implementation of the action plan in year 2. So there's, again, some goals that we really want to focus on getting participants from point A to point B. These are just the dates that we are showing for you. We're releasing the application today. They will be due December 6th. You will get notification by December 14th. We will have some links and homework resources due by January, and then follow with a case study, a coaching session, which will focus on your individual action plan, then the sharing of the action plans, and then the face-to-face as mentioned previously. And that's the application link. And with that, Ellen, I think we'll skip back. I see some questions have come in, so we'll go to the questions now. I'll go back to Carrie's question. And Marlene, this question is for you. Carrie wants to know, what types of data outcomes did you focus on in your MLP work? Thank you for enlarging it, Hannah. Let's see, I lost my place. Okay, there it is. Focus on your MLP work, and what do you think was the most convincing to the hospital administration to get them on board with providing financial support?
Yeah, so our data and outcomes we focus on, we try to look at what difference has legal assistance made in the client's lives. So are they more stably housed? Are they keeping more of their doctor's appointments? Are they reporting less stress, less complications with their chronic condition, et cetera? And then what I think was most convincing to the hospital administration to fund us was actually the medical champions that we have at our various sites. We have 2 champions, one for our pediatrics and one for our adult side at the homeless center, who really went to bat for us and talked about the difference that our services have made in their clients' lives and the changes that they see after someone receives legal assistance. And I think that really made the difference for us into showing the hospital why it was worth it. We also ran some numbers around savings to the hospital. For example, if someone's approved for Social Security and they get Medicare, and now the hospital is getting paid for the services that they provide. We also did some looking at clients who had been high utilizers of the emergency room, and then after getting housed and on benefits and things, are utilizing those services less. So we tried to work that angle as well, but I really think that the medical champions at our 2 sites were what got us fully funded.
Great. Thank you so much. Appreciate that. The next question is from Elaine, and how are the universities, colleges involved in MLP, especially if student populations are vets?
So I can take that one, Darlene. Thanks, Elaine.
Okay.
And I would say that universities and colleges are involved in a lot of different ways with medical legal partnerships, sometimes through courses that are offered that are training the next generation of clinicians or lawyers or public health professionals to think in a cross-disciplinary fashion. I would say that in terms of student population accessing those services, I would say that these are focused on low-income consumers of healthcare services, right? In terms of veterans accessing services, that is, those programs are happening for the most part through VA medical centers, although there are programs that are operating in hospitals and health centers that take care of veterans as well as other populations. And so I would say it's kind of a little all over the place in terms of the target population aspect, but in terms of the role of a university in helping to advance MLP practice, I think is really critical. As someone who sits inside a university myself, this is where some of the best research is happening. This is where a lot of the training for the next generation is happening, and this is where a lot of the innovation is occurring in terms of weaving legal services into social determinants of health interventions.
Great. Thank you, Ellen. And then our next question is from Jennifer. It says, what are your priority selection criteria for the first MLP LC cohort, and will there be subsequent cohorts?
I'm happy to take a stab at that too.
Okay, then go ahead, and then
yeah. You want to start, Darlene?
No, go ahead, and then I'll
Okay.
add.
Yeah. Thank you for that question. We hope there are subsequent cohorts, and we think there will be if this cohort is successful. And so what we're looking for in applications is the conditions for success, which is a commitment from the healthcare organization to first to participate meaningfully, and also we do want to see some indication that there's been some exploratory work done so that you know a little bit about what you're getting yourself into. You're not starting from, minus square one. So we would want to see some experience and insights regarding partnering with lawyers, and our job is to help you move to that next level. We don't think that you need to have achieved certain benchmarks, as Darlene was saying. What we want to see is the right ingredients, and that's how we built the application, is to elicit those ingredients, and that includes leadership and commitment and some innovative thinking and a commitment to a data-driven but flexible approach. So, Darlene, other thoughts?
Right. No, yeah, I would just encourage, I don't want people to feel that they have to have all of it figured out before they can apply. I mean, I think that's what hopefully we will help you do. But as Ellen says, have some idea. But we really, I guess, we have been working on this for, 3 years, Ellen, as I said?
That's right.
And we're just trying to really get the HCH community to move on this particular initiative. We know that our patients, our consumers, have the civil legal needs that aren't being met, and so having a legal partner come and get it integrated into primary care is very, very important. So how do you do that, and how we can help you do that is really the goal of what we want to get you to a place where we can do something to move you on that continuum of implementation or starting designing MLP. So don't be discouraged if you aren't that far along the continuum. If you just have started as I said, preliminary conversations, or just have identified a legal partner, please apply, and we'll try to move you as much as we can during the time in the cohort to a place where we at least can show some type of advancement in the vision.
Great, here. And to that effect, too, and I think that the Silicon Valley slide was helpful in this regard, Marlene's reflections about how long it took to get where they are, right? Lest we forget, 10 years. We'd like to have that, maybe, to 5 years.
Right.
And I just want to point you to also another resource that we included, which is a deep dive on a program that's down in Texas at a health center, and it has a nice timeline in it that talks about over a period of 8 years, the work that they did and their thinking and partnering and learnings. And so I think, again, that'll be helpful because we understand this doesn't happen overnight. And as Darlene said, we want to meet you where you are and bring you a little bit further, and don't don't feel like you need to solve this problem before you hop in with an application, but instead tell us what kind of ingredients you do have and let us help you figure out the rest. So.
Great, thank you. Were there any more questions? I don't see any in the queue. If anyone has any questions, please feel free to insert them in the chat. We have about 5 minutes. I'm going to move to our last slide. And this is from one of our partners in North Carolina at Lincoln Community Health Center, from Sharita McColliers, and she is has been working with MLP for quite a while. She presented at our conference a few years back, and so she understands just how helpful it has been to have the MLP there. And I see people are typing. Ellen, is there anything you want to add about the Lincoln? I know you know the legal partner on this this MLP very well.
Yeah, I think that the legal partner has brought an expansive vision to this, and that has been enormously helpful in a flexibility, and I think that's the watchword for any cross-sector partnership, right? And so it may be that you have a particular vision for how this should be operating, and maybe we are going to, part of what we're going to do in the Learning Collaborative is help you to adjust that vision and customize it to your own locale. I think North Carolina's done a great job on that. And they have multiple MLPs around the state and have, I think, a good sense of how to both standardize and customize at the same time. So that's not an easy thing to do, but I think essential given resources, given populations and settings. So do we have a question coming in here?
Great, yes. I work in an MLP, this is from Catherine, I work in an MLP for high emergency department utilizers with behavioral health needs. Many of the clients experiencing homelessness are also actively using substances. Does anyone have resources or suggestions for presenting this that issue to landlords and benefit programs?
I mean, I can take a stab at that and see if I understand the question, which is that I think one of the keys and really the rationale in many respects for medical legal partnership is some of the best messengers for legal advocacy are our healthcare partners. And so really asking our healthcare partners to provide the documentation appropriately to do that advocacy so the lawyers can do more effective advocacy with landlords and benefit programs. I think that is really the crux of some of the work. I think that responds to the question, but maybe Marlene, I don't know if you have ideas there too, if you're hearing.
Yeah, it's been a while since I practiced in housing, but I would say that the doctors are often better presenters of these than lawyers and more disarming to landlords than lawyers. Having a letter from a doctor rather than a letter from a lawyer, I think often goes over better with landlords. As far as benefits programs, I would just say substance use is not a deal breaker for Social Security cases. That's the program that seems to care the most about substance use. It's not a deal breaker, and if you're looking for resources on sort of how to overcome drug and alcohol use in a Social Security claim, I'm happy to share what my office has stored away for our cases.
Great, thank you so much. I should mention that these slides in this presentation will be available. I should have mentioned that at the beginning. Usually it's posted to our website, nhchc.org, within 3 business days. So you will have access to the slides as well as this presentation. There's another question that came in. Wait, let me scroll up here. Would a program that specialized in family law and limits eligibility, it keeps jumping, limits eligibility to those patients, clients who have experienced intimate partner violence, sexual assault, be a good fit for the cohort?
I mean, here's what I would say from my perspective, and Darlene may have her own. I think that what that depends on is it could be a good candidate depending on the engagement and commitment and numbers that you're talking about within the healthcare organization, right? If that's a priority area, then I think that's great. But if it's a priority area for the legal team but not as much for the healthcare team, then I'd just be rethinking that. I don't know, Darlene, if that makes sense.
Yeah, I agree. Yeah, it does make sense. Yeah, thank you.
Yeah.
And how can MLP be incorporated into a penal system? We're coming down to our time, but this last question, and then we'll answer any others offline if possible. Feel free to email us, and we'll give you our contact information on the next slide. Let me do that now. But one last question, how can MLP be incorporated into penal systems before reentry citizens are released in the community? Pre-plan releases plan?
Yeah, I mean, so I would say that I think that this is really super important, a great place to be deploying co-located and co-integrated services like this, but again, really being thoughtful about how you weave this in terms of the legal services alongside the healthcare services, so that you're not creating, kind of distinct programs that aren't actually integrated, but instead are kind of sitting alongside one another. So.
Great. Thank you. Okay. Well, thank you so much for joining us today, and please contact us at the emails that you see there, and we will try to answer any questions, subsequent questions that come up. And again, we encourage you to join our learning collaborative, and we think that it will be a great experience for all, and we want to thank you once again for joining the webinar. Are there any final words, Ellen or Marlene?
No, just thank you so much, everyone, for your interest and willingness. We look forward to seeing your applications.
Great.
Thank you.
Thank you, and happy Thanksgiving to everyone as well. Thank you, Carrie. Appreciate the message. Have a great afternoon, everyone.